This week. March is Cerebral Palsy Awareness Month, a time when those living with this disease, as well as their family and activists, they all come together to advocate for this community. So Dr. Vedant Kulkarni is Assistant Chief of Orthopedics at Shriners Children's Northern California, and Michael Cimino is one of their patient ambassadors, and we are so thankful to have you two in studio with us today. So Doctor, I want to start with you. People hear about this condition a lot. I don't think they fully understand what exactly it is, though. So is this a condition that someone is born with, or can this develop over time?
Well, the answer to both questions is yes.
Okay.
So cerebral palsy can be broken down into the two words cerebral, meaning brain, and palsy, meaning weakness of muscles. And it actually describes a group of disorders of the infant or developing brain that causes problems with movement, posture, balance. And really over time, what can develop is muscle problems, and even bone problems that we as orthopedic surgeons can manage. It does require multidisciplinary care, which is something that we do at Shriners and many other regional hospitals, and involves people of different disciplines all getting together to help patients like Michael have the optimal function possible.
And does the diagnosis take a lot of time, or do you guys, when the symptoms come in, you're like, okay, this is probably what it is? Yeah,
it does take a little bit of diagnosis, and what ends up happening is that usually parents or caregivers will notice that there's some delays in the child's development, usually motor development, and that prompts the workup, which is usually done by a neurologist or a physical medicine and rehab doctor. Once the diagnosis is made, it's really important to have early treatment.
Sure, of course. And then treatment. I mean, we are always seeing advancements in medical technology. Where do we stand currently with treating this?
So with cerebral palsy, it's really important to understand that even though the brain issue is permanent and not changing, because the child is growing, there can be problems with growth and development. And so there's a couple different things that we do. First is early interventions. These are physical therapies and other therapies to try to get the child to make those motor milestones more adequately. And then we also do things like hip surveillance, because actually, you may not know, but cerebral palsy is the _1 cause of motor disability in children. And up to 1 in 3 children can end up having hip problems.
Wow.
And so we do early detection with x-rays, which is called hip surveillance. And we try to detect these problems early so more effective treatment can be done.
Amazing. Love that. And Michael, how old were you when you were first diagnosed with this?
I was diagnosed with cerebral palsy at the age of 18 months.
18 months, okay. And then, so what has it been like living with cerebral palsy all these years?
I didn't really realize that I had cerebral palsy until I was 7 years old. And I really thought, like, why or what, like I didn't really understand that at the time, but as I grown, I have three surgeries in Shriners. They've helped me develop my mental and physical, and living with it, you know, people look at you and you just want to be more active and all these other things, and you know, you just got to live on with it and have treatment and, you know, try to be yourself.
Absolutely, and try to do the best that you can. I mean, how is life for you now? How do you feel?
Well, I'm in 7th grade. I take school. I have a media class, so this is like extra credit for me. So, no, it's very, I think it's a great life. I mean, I have Shriners that helps me so much. I've had 3 surgeries, like I said before, and I just love it. I mean, it's nothing says back.
Great attitude. I love that.
Thank you. I really appreciate it.
I love that. You're just a bright, shining light right here. And so if people want to be more involved in this, or if they think they have a child that is showing symptoms of cerebral palsy, how do we reach out to Shriners?
Referrals can happen through their primary doctor or through specialists or self-referrals. And it's important for them to know, people who are referring here, that Shriners really offers multidisciplinary care. And for example, for Michael, he was able to get 3-dimensional motion analysis to do very specific surgeries to help him get better. We have orthotics on site, physical therapy on site. So all of that is available to them.
I love that. Thank you both so much for coming in here and talking about Cerebral Palsy Awareness Month, and thank you for all the work that you do at Shriners Hospital. We so appreciate it. And Michael, best of luck to you. Good luck. I hope you get that extra credit today, sir. I hope they're watching. Okay. All right.